This is the video on the lower motor neuron. The lower motor neuron is typically the final common pathway for all muscle output. It starts in the anterior horn, or ventral horn, of the spinal cord. The axons go out the ventral root of the spinal cord to the muscles under control at that level of the spinal cord. For example, the cord at the 5th cervical level controls the bicep muscles. Many inputs come to the lower motor neuron, both from the pyramidal tract and the extrapyramidal tracts. The main input to the lower motor neuron is from the motor strip of the cerebral cortex, but this is modulated and adjusted by all the other extrapyramidal tracts to produce smooth, coordinated movement. The lower motor neuron is responsible for our reflexes. A simple reflex arc is composed of a sensory input and a motor output. A sensory nerve synapses on the motor neuron directly, producing a quick response that is reflexive and unconscious in nature. It will occur again and again in the same way. Some of the reflex arcs include an interneuron, a small neuron positioned between the sensory axon and the motor neuron. All sensory input also goes up to the cerebral cortex. However, this takes a bit longer to arrive to conscious levels, and the reflex has already happened. If there is damage to the lower motor neuron, the symptoms are different than those of upper motor neuron damage. When a muscle fiber loses its connection to the lower motor neuron axons, the muscle fiber starts to die. This loss of muscle cells, and therefore strength and muscle mass, is called atrophy. The muscle is reduced in size and therefore cannot contract as strongly. This leads to weakness and paralysis. Another symptom of lower motor neuron disease is fasciculations. These are spontaneous and involuntary contractions of muscles which are visible as twitching under the skin. They are not strong movements and do not move the limb, but appear to be small, tremulous movements of the muscles. Lower motor neuron diseases include spinal muscular atrophy, progressive bulbar palsy, and progressive muscular atrophy. Obviously, if the spinal cord and brain are disconnected, the person is paralyzed from the level of injury down. There is no voluntary movement below the site of injury, and currently, this is a permanent condition. Amyotrophic lateral sclerosis, ALS or Lou Gehrig's disease, is a combination of upper motor neuron and lower motor neuron dysfunction. This disease produces progressive weakness in the musculature until it affects the diaphragm. Once the diaphragm is involved, the patient is no longer able to breathe and must be put on a respirator for the rest of their life. The typical lifespan after diagnosis is 2 to 5 years. There is no cure. This ends the video on the lower motor neurons.